actual procedure itself was not very difficult at all. I would equate it to going to a dentist, maybe not even that bad in terms of the level of discomfort. I was able to drive myself home. I went home and took about a 40-minute nap, and then I got up, and then the next day I went right into work and noticed no difference. But I almost immediately felt a relief of pressure in my sinus area. So it was not difficult. You know, following that, I had been having 2 to 3 pretty major sinus infections a year, and the difficulty with that is, you know, they were very debilitating, and then I would stay sick and I would stay on antibiotics for long stretches of time. In the last year, I haven't had any sinus infections, and you know, now when I get a cold or something like that, it just is a normal cold. It doesn't turn into some major kind of an issue. So I would say that if you are struggling with your sinuses, you need to really seriously consider this operation. I got to the point where I was actually desperate about my situation, and I would have taken any kind of improvement whatsoever, and I would have to say that I got more than what I had hoped for from the operation. You know, and it's just been a great feeling this past year. I've been able to resume some activities that I couldn't do in the past. Running, being more active. I didn't constantly have that sinus postnasal drip all the time, and you know, not taking the medicines on an ongoing basis has just really improved my life. So I would say to do it.
How has it affected your healthcare budget?
You know, I was taking some pretty major antibiotics towards the end, because as you know, your tolerance for these things gets higher and higher and higher, so you have to take more and more extensive antibiotics. I was taking things like steroids to help enhance the antibiotics, and so you know, those aren't cheap, and they can run up $200, $300, you know, a run and that kind of stuff. And you know, your insurance covers part of it, but that's still a lot of money going out. And I haven't had to spend any money on antibiotics, maybe some Mucinex every now and then if I get a head cold. So it's been a real improvement, just financially, peace of mind, just overall quality of life.
Oh, that's fabulous. You used the word operation, and certainly I was using that at the time. People are starting to describe this more as an office procedure,
Right.
as an effort to avoid surgery,
Right.
the rationale being that we actually don't remove any tissue.
Right.
Do you think that that's a fair assessment to call this an office procedure, or did
Absolutely.
it feel like surgery?
No, it feels like an office procedure. It's one of those things where they do it and then you're kind of like, oh, are you done? And then you're out of there. Again, yeah, you're under a local anesthetic. It's not painful, and it's done in. It probably took under a half an hour, if that. It's kind of hard to remember it specifically because it was that, you know, uneventful. But it was a very quick procedure. I would call it a procedure.
That's fabulous. Well, I'm glad you're better, and if you have any problems in the future, you're welcome to come back.
Thank you very much.